Hey everybody, this is the Growth and Development lecture for our Nursing 201. This is one of my favorite topics to teach because it is the stepping stone to OB and PEDS. We have to have a good, solid foundation and an understanding when it comes to growth and development, normal growth and development, in order to apply it to our pediatric clients in the hospital, as well as the maternal child nursing. When we get to that next semester, we're going to be building on these fundamental concepts of growth and development. So this is kind of our little stepping stone. We're going to talk about healthy children. When you get to nursing 4, we're going to go more into the pediatric illnesses, and we're going to branch off of the normal growth and developmental milestones. You would have already learned this in your psych courses, whether it was abnormal psych or if you took a developmental psych. So really, this should be a refresher when it comes to the basics and the fundamentals of growth and development. However, what we're going to be focusing on is the nursing implications for it. Okay. So the terms of growth and development, they're often used interchangeably, but they are very different. Okay, they kind of go hand in hand, but growth denotes an increase in physical size. That's more of your objective measurements, whereas development indicates an increase in size or the ability for functioning. Okay, development can be measured by observing a child's ability to perform specific skills, such as how well they pick up small objects, right? Such as raisins or Cheerios that pincer grasp, or how they walk. Also by recording the parent's description of a child's progress, right? That's going to denote our development. Or using standardized tests, such as the Denver 2. So, one of the things that I will note about this lecture, this PowerPoint, is you're going to see a lot of pictures in here that are actually of my children. So this is actually a picture of my firstborn child right here, Chloe, with my 2 former dogs who are no longer with us, and my daughter is now 16 and a half. So let's talk about factors influencing growth and development. So there's several different factors that influence a person's growth and development. The environment. Genetics, obviously, that's a given, right? So the genetics, with it, whether it be gender, health, as well as intelligence, growth and development can be altered by frequent hospitalizations. So when we get to next semester, the care of the hospitalized child, one of the things that I have you guys look at when it comes to the pediatric rotation is what are any abnormalities within the growth and development with that child. Are there any impairments or any delays, especially for your chronic patients that are frequent flyers in the hospital due to whether it's cancer or frequent admissions if they have respiratory issues, cystic fibrosis? Think of how those frequent hospitalizations, kind of living in that hospital environment and not home, how they can alter our growth and development. Some illnesses also that are genetically transmitted, right? Temperament actually influences growth and development. And temperament is an inborn characteristic that's given to us at birth. And it's how an individual does 3 things. It's how an individual reacts to stimuli in their environment, right? So some children adapt quickly to change, others don't. Others adapt slowly. They need more time to adapt to their environment and their surroundings. So the temperament is based on 3 characteristics. 1, how they react to stimuli environment. 2, how they behave. And 3, how they think. Okay? So we need to help parents understand that not all children are alike, right? We want to know their temperament patterns. So what's their activity level, the rhythmicity, their approach, the adaptability. And these are all temperament patterns that are located in your pituitary. That I do want you to review. Star circles highlight that. Y'all know what that means. Environment. So when we think of the environment, we think of what's around us, right? The first thing that always comes to mind is our socioeconomic level. So, believe it or not, family income does affect healthcare access, right? If they don't have access to healthcare, access to, nutritious foods, immunizations, a healthy environment, that can affect growth, right? The child may be shorter due to poor nutrition and maybe not due to genetics. Their home environment, living in a home that has an increased exposure to lead if the home's in an older neighborhood or if it's being renovated, right? That can stunt a child's growth. Nutrition. So nutrition is crucial to the newborn, especially within the first year of life.
I'm sorry.
Okay. And then lastly is disease process. So when we look at, like we said, the chronicers, the respiratory, cardiovascular, heme immune, musculoskeletal, the digestive, our endocrine and metabolic disorders, our kids that have kidney or urinary diseases, and like your skin and your neuro, looking at the disease process and how they can affect and alter the child's growth and development. All right. So theories of child development. We look at all the different theorists when it comes to growth and development. And you guys, like I said, you would have learned this in your general psych or abnormal or developmental psych courses. And we're just going to kind of refresh on it. This is just one theory to blend in with the others when it comes to management of children. Okay, so Freud is the psychosocial, psychoanalytical theory of personality development. It's the one that really everybody is mostly familiar with, not the one that we kind of focus solely on or heavily on when it comes to nursing care. When we look at nursing care and growth and development, we look at Erikson. All right, so Erikson's theory of social development is really primarily what our NCLEX is based around, as well as our nursing care. But we do want to make sure that we are familiar with all of the theorists within the child development, because we do need to have a good, healthy blend of it. All right, so what Freud said is they begin in the oral stage, right? And when we're talking about infancy, the oral stage, the infant derives pleasure from oral stimulation, right? Sucking and eating. So it's really important that we get that oral gratification, whether it's using a pacifier or a bottle or breastfeeding. We want to teach parents and caregivers the importance of responding to that hunger that infants feel in a timely manner, okay? So provide a pacifier if the infant's unable to take any fluids or food by mouth. Okay, so if the baby's NPO for some reason, if they're going for a procedure, we want to make sure that we're satisfying that gratification by providing the pacifier. Okay, the next phase or stage is the anal stage. This is where the child's pleasure is centered in the anal area. Okay, control over body functions are a prime focus within this age group. So some nursing implications are to teach parents to avoid any pressure or punishment when it comes to toilet training, or it can become a power struggle. Okay, we want to make sure that we inquire about toileting rituals or patterns in the healthcare setting also. So if you're dealing with a toddler and preschooler, we want to inquire about what their patterns are, and we want to try to be as consistent as can be with that. Okay, the phallic stage, when they get a little bit older, this is where the pleasure shifts from anals to genitals area. Some nursing implications, some masturbation can occur. The child may insist on being with one parent versus the other, and you want to explain to the parents that this is normal. It's a normal phase at this stage. And we may, when it comes to assignments in the hospital, we may need to assign a male or a female RN if a child shows preference for one or the other. All right, and then lastly is the latency stage. So there's only 4 stages with Freud. The latency stage is where the child's libido is diverted into concrete thinking. So sexual energy is at a rest, but privacy is a big issue with these guys, okay? So some nursing implications would be that the children tend to play with kids of the same sex more. So they may have friendships that are of the same sex. And they may need more privacy in the hospital. So you want to make sure that you're providing them with that. Knock on the door before entering, right? That shows given their privacy. Let them keep their underwear on underneath their hospital gown. These are all normal things that you can help address this latency stage, and not, once again, not make it a power struggle. If they can keep their underwear on underneath their hospital gown, allow them to do so. All right, now on to the important one. Just kidding, they're all important. This is just the most common one that we look at. Our Erickson, right? Erik Erikson. And they say that there's the four phases or stages of childhood. And this is the theorist of the psychosocial development. Okay, so the first phase, infancy, trust versus mistrust. And I will say, you have to know these. You've got to memorize them. You need to know which phase is which, correlating it to each the age of the child. Okay. So some nursing implications for the infancy, trust versus mistrust. We want to make sure that we're providing consistent care, consistent caregivers, consistent RN care. The need for food and other comforts are met in a timely manner. We have to educate parents, new parents. We're not on the caregiver schedule. We're on the baby schedule. Okay. The baby that's fed on demand learns to trust that cry. Okay. So their crying is the only form of communication that they have the ability to use. So by them crying, to let the parents know that they're hungry, and the parents feeding the baby on demand shows the child that their needs are going to be met. Okay. Toddlerhood, autonomy versus shame and doubt. So some of the things we want to do with this is allow the children to do things themselves, right? Having them accept that independence. All right. The toddler gains reassurance from self-feeding, from crawling or walking independently when it is safe to do so. All right. And the toddler is also experiencing their own body. So if the caregiver responds appropriately to this normal behavior, the child's going to gain self-respect and pride. Okay. If there's a lot of shaming in the child, they're going to learn that their body's dirty, the body's nasty, and have, shame. The preschooler's initiative versus guilt. So some nursing implications with this is exploration of what they can create, right? You want them to take initiative, go out and take initiative. So they like to explore the things that they can do, the things that they can create, and seeing what they can do with their motor, their language, and their interpersonal skills that are developing, right? You have to allow for endless questions with this population. Physical and intellectual explorations, right? This is the why phase. Why? It's endless questions. Active assertive play, they like to kind of show off to adults to kind of gain attention and approval. It's affirmation of approval. And it is during this time that a child develops the conscience. Okay. They want to know the rules and they enjoy being good. Okay. School age, industry versus inferiority. These kids, we use physical, cognitive, and social skills in preparing them for success in the adult world. They like to promote achievement in school. They have interpersonal relationships and living up to expectations. So see how it's kind of a stepping stone from preschooler to that school age. Okay. Competition is healthy as long as the standards aren't set too high, whereas they can't achieve them or can't win, right? We want to praise, not criticism, is going to help the child build their self-esteem and avoid those feelings of inferiority. All right. Piaget. Piaget is the theorist of cognitive and intellectual development. So within the 0 to 2 year time frame is the sensory motor thought. So there's a reflex that happens, and then there's repetition, which then causes voluntary acts, right? So what this means is via a reflex, something happens. It happens again, and again and again, and the infant will start to respond to it, which then leads to voluntary acts that progress to banging, shaking, pulling. Okay? This stage is linked to the desire for physical satisfaction. So it promotes the development object permanence, right? Whereas random arm movements that hit a crib overhead, right? That hit a crib toy overhead. Random movements, that's that reflex that hit that crib toy and turns that toy on, is going to deliver a sense of euphoria, right? Satisfaction, and then a sense of purpose, like, okay? So those movements eventually become purposeful and deliberate as the infant grows to understand cause and effect, okay? So some nursing interventions during this phase are provide these types of toys, provide age-appropriate toys. And these can really be beneficial to use them as a distraction during procedures, okay? The next is the preoperational thought, which is 2 to 7 years. This is where they have egocentrism, centering, and lack of conservation. So you can use symbols to represent objects, right? Because their concept of time is now, right? And their concept of distance is only as far as they can see it, right? So they can't understand somebody that lives, across the country, or somebody that lives, you get on a plane and go see somebody. They can't understand that concept of distance because it's only as far as they can see, as well as the concept of time, which is one of the reasons why children of this age group are so impatient, right? They don't understand it will come. Time will come. They need to have patience. Asking them to have patience is really kind of it's not gonna, unrealistic expectation. These kids tend to draw conclusions only from what they can see, okay? So if you think about it, the pattern, think like daddy shaves and goes to work. Then they believe that every time daddy shaves, they're going to go to work. It's kind of almost like that Pavlov's dog, right, with the bell. Or think of it from a hospitalized child perspective. The nurse comes in to change the sheets on the child's hospital bed. Then the child goes into surgery. The next day, if the nurse comes in to change those sheets, that child's going to think, I'm going in for surgery, okay? And it might cause a little bit of anxiety. So those are some of the things that you would want to think of. So the child's cognitive abilities at this stage, like I said, it involves egocentrism, where the child perceives their thoughts and needs are better or more important than those of others, right? Kind of that egotistical egocentrism, right? Their thoughts and needs are better or more important than others. So you don't want to tell the child, so some nursing implications, don't tell the child, please take your medicine for the nurse. Please take this for your mother. Please do this for your father. Because of that concept of egocentrism, you're going to be totally defeated, okay? It's not going to be applicable. It's not going to be workable. Centering, the child looks at an object and sees only one of its characteristics, okay? So if they look at a banana, they see the banana as yellow, but they're not going to notice that it's also long, right? They see one characteristic. They kind of center on focusing on one characteristic of an object, okay? So some nursing implications with that, you want to allow the child to hold, touch, play with the equipment that's used in our nursing care to help them understand that there are more than one aspect to the object, okay? Lack of conservation, I think this is the most frequent one that we come across. The same amount of liquid in different height glasses is not the same to them, is not the same amount of liquid, okay? They lack the concept of conservation, okay? So you want to put the liquid medicine in a large glass. This is going to encourage the child to think, oh, it's not that much. But if you put 30 milliliters, 2 tablespoons, in a small medicine cup, that's filled right to the top. They're going to think that's way too much. So remember, they lack that conservation. If you want to get them to drink it, put it in a larger glass. They say that's not that much. Okay. Concrete. Yep, we talked about that. Egocentrism. Um, Magical thinking. This is giving lifelike qualities to inanimate objects. Okay, so asking, them holding their teddy bear, to them that's a real lifelike object. To us, we know it's just a plush toy, but to them, that is a living, breathing creature that it goes through life just like we do. So that can be played up to your advantage as well for a child that really kind of adores that object, especially in the hospital. Let them bring it with them. All right, concrete operations 7 to 11. This is where they're able to classify objects and learn broad concepts as well as subgroups, right? So we start off with fruits, and then within the fruits, we have our subgroups like our apples, our grapes, our oranges, our pears, right? So they're really starting to learn broad concepts and then narrowing it down to subgroups. They have a rigid, egocentric outlook of preschool years that are replaced by the ability to see things from another point of view. Okay, so this is really where there's a ton of growing brain development in this phase. They realize that that lack of conservation is now, the amount of fluid does change due to the shape of the glass, or the mass of the clay does not change when its shape is changed, right? That's the concept of conservation. And then lastly is our formal operations, which is over 11 years. This is where they start to think introspectively. They're capable of dealing with ideas. They're capable of dealing with abstract concepts and can understand jokes with double meaning. All right, here's Kohlberg. Here's our theory of moral development. So this is where, we want to look at all these different theorists and we want to blend them into, when we talk about holistic care, we're not just looking at the physiological problem. We look at the person as a whole. It's the same thing when it comes to the growth and development, because we want to kind of blend all these theorists together. We talked about the importance of cognitive development and the importance of social development and the psychoanalytical and the psychosexual, whereas Kohlberg is the theory and development of morals and the development of those morals. So Kohlberg, 0 to 2 years is the pre-religious stage. Obviously, infants have little concept of morality or any motivating force beyond their parents, right? There's nothing that motivates them other than their parents at this time. Basic good-bad behavior sculpting helps to develop trust, which develops into a moral conscience as they get older. Okay? Pre-conventional, 2 to 7 years. In toddlers and preschoolers, they begin to formulate a sense of right and wrong, but mostly motivated by wanting to satisfy their parents rather than spiritual satisfaction. The conventional stage, these are our school age kids that are learning orderly affairs, right? Good girl, bad boy, fairness, being fair, which is going to help sculpt their morals. They have a basic understanding of what is right and what is wrong. And then we've got our post-conventional, which is over 12 years and up. These are our adolescents, right? Adolescents understanding morality and abstract thought. Not only doing something that's considered wrong, but what effects it can deprive another. Okay, so this is really where that stuff starts to come into formation. All right, so the basic principles of child development. One of the things I will say, children are competent. Children can resemble one another. We said not all babies are alike, not all children are alike, but they can resemble one another, which is why when we look at newborn security, it's one of our priorities in the newborn nursery. Each child's unique. And then also the way that they grow, or the way that they grow and develop, is cephalocaudal and proximal to distal. Okay, so they grow from head to toe. They need strength within their neck first. So the growth and development of their head and their neck needs to occur before they can use their feet and get strength of their feet so that they can start walking. Okay, as well as proximal to distal. So central to out. When babies are born, we care about their central circulation, right? When you look at the APGARs and you look at right when a baby's born, we look at their apical pulse, their central coloring, and then when you look at their arms, their limbs are kind of purplish, and that's because of that immature circulation, and that's because of the proximal to distal development. And development is timely. There are crucial periods of development that we need to be keeping our eye on, and we want to make sure that we are screening these kids. If you're the nurse working in a pediatric office and you're doing these wellness visits, there are crucial pieces of information that we need to be collecting to see if these children are achieving those milestones and if there's any delays in them. So these milestones that we're going to be looking at. So within the Erickson's theory of psychosocial development, these are some milestones that they should be doing. So the baby is going to double their birth weight at 6 months and then triple their birth weight at 12 months. So there's a huge period between 6 to 12 months where they should be tripling their birth weight. Okay, big area of growth there. At 5 months, the baby should be turning from their front to their back. So often, if they're doing tummy time to help gain strength of their neck, the first way for them to turn is usually from their belly to their back. Okay. And then a month later, at 6 months, they can turn both ways. They can go from belly to back, back to belly. Okay. And then they start to roll, which is a huge safety thing. So when we look at turning, once they do start to roll, you want to make sure that A, the parents aren't leaving that child unattended on the diaper changing table ever. But B, if they ever do, once they start turning, now they're definitely going to be at risk for falling. We can introduce solid foods. And when I say solid foods, I mean the fortified iron cereal, as well as applesauce, fruits and veggies. Okay, so pureed carrots, pureed beans. That's what I mean by solid foods. I don't mean literally, toasts and steaks and things like that. So solid foods can be introduced about 4 to 6 months. They can start to sit up without support at 8 months. So they should have good neck and back control at 8 months. They start to develop some separation anxiety as well at this time. So you're going to notice that when mom starts to go off to work, or if dad goes off to work, anytime a stranger may come in and, take the baby, like if you're at the doctor's office, if mom walks out, they're going to get some anxiety. They're going to cry when they leave. Okay. If you go into another room, the infant may cry. They're going to develop object permanence at 10 months. So knowing, when something's taken away, knowing that that object is gone now, right? So they are going to develop that at 10 months. They're going to develop the pincer grasp at 10 months as well. So this is where they can start to eat with their forefinger and their thumb. They can pick up foods like Cheerios or raisins and start to feed themselves. And then walking at 12 months also. And 2 words. So they should have, by 12 months, 2 words in their vocabulary. And usually it's mama, dada. So the separation anxiety that can occur at this 8-month period, it's really important. This is going to be an important piece of education, because we want to make sure that we're teaching the parents that this is all normal behavior. Okay, their child is adjusting. Okay, they're not regressing. They're not going back to that newborn phase with always crying. It's a normal part of growth and development. So it's important for nurses to consider this in the healthcare setting. If you do work in the pediatric unit, this age group will do better if assessments and procedures are done with the child on the parent's lap, okay, so that we can avoid any kind of that unnecessary stress and separation anxiety. All right, so we kind of already talked about this, right? Some of the nursing implications with infancy, promoting that trust, right? Meeting the infant's needs in a timely manner can help promote that sense of trust. A predictable schedule, right? Infants can get a sense of what is coming next if they have that predictable schedule, which will help achieve that trust. Promoting safety, right? We want to always think of safety, right? Accidents are the leading cause of accidental death within this age population because of aspiration, falls, or not being restrained properly in a car seat. So they need to know, like I said, when they start to roll over, some of the implications that go along the lines with that to help promote that safety. Okay. Promoting nutrition, I'm actually going to talk about this on the next slide. Okay. But basically, when it comes to nutrition in infancy, we want to make sure that we're preventing any baby bottle syndrome, which is when parents may place the infant in the bed, prop their bottle up so that they can kind of just drink and fall asleep. We want to prevent that from happening, the baby bottle syndrome, because what it can do is it erodes the tooth enamel. So the carbohydrates from the formula, which is very high in carbs and sugar, they ferment to organic acids that demineralize that tooth decay. So what we call bottle rot. Okay. So not only does it increase their risk of ear infections because of that straight eustachian tube, and when the infant falls asleep there, ear infections, aspiration, but also it can cause demineralization of the tooth enamel. We want to promote development. So once again, providing toys to promote those fine motor developments, such as rattles, large blocks. We want to promote gross motor development by providing a safe space for them to crawl and roll, and promote growth with adequate sleep. So remember, infants generally need about 10 to 12 hours of sleep at night, plus 1 to 2 naps during the day. So it's really important to make sure that the child is getting those necessary hours of sleep and rest during the day, which helps promote brain growth. And provide healthy and family functioning. So we want to be teaching our parents about normal infant behavior. Teach them that infants have different temperaments, right? Some may be more fussy than others. Some may need quiet to sleep. Others may need loud stuff to sleep. Teething can cause fussiness, right? Because the infant may not want to eat because their gums hurt. So, once again, it's not, it may be a physiologic thing going on, or it may be their temperament. Here's some examples of. All right, so here are some examples of aspiration risks within the first year of life. Okay, so here a little picture of the lungs here. They have a smaller diameter lumen of trachea here, and bronchi, which is going to increase the risk of aspiration, right? Smaller little hole there within their trachea and the bronchi, which makes it easy for things to get stuck and occluded. Latex balloons are leading cause of aspiration, whether they're partially inflated, uninflated, or popped. Actually, the leading cause. You never want to allow parents to inflate the latex gloves in the pediatric setting because of that risk. I know, some nurses love to do that. They blow up the latex gloves and make little balloon animals out of it. But balloons actually terrify me because of the effects that I've seen of some of the kids that are now permanent residents of St. Margaret's, all because of balloon aspiration. Peanuts, popcorn, and hot dogs, especially sliced in circles, are a risk for aspiration. So hot dogs, that's a common food that we give to kids, but we want to avoid them being cut up in circles. You want to put circles and then half them. All right, nutrition during infancy, and that is a picture of my child. I'll always tell you when my kids come up. That's my second child, who's now 13, going to be 14. So nutrition during infancy, we want to, they're going to be on breast milk or formula within the first year. We do not want them taking in any whole milk until after age 1. Okay, so no whole milk until the age of 1, and then we do want to switch it to that whole milk. Okay. Follow-up formulas, or like next step formulas, don't really give any advantage over regular formula after the first 6 months. And they actually can provide too much protein, according to the American Academy of Pediatrics. Um, Breast milk, um, I'm sorry, yes, solids at 4 to 6 months. So it's 4 to 6 months of iron fortified rice cereals when we can start to introduce that at that 4 to 6 months, which is mixed with breast milk, formula, or a little bit of orange juice, which I don't typically recommend, but it can be to get the child to start to eat it. So they mix that iron fortified rice cereal with either breast milk or formula. We know infants are ready for solids when they're nursing or eating vigorously, like every 3 to 4 hours, and they're just not satisfied. Okay. However, FYI, infants are not ready to digest complex starches until the amylase is present in the saliva at 2 to 3 months. Okay. So you want to make sure that you don't introduce anything prior to that 4 months because they're digestively, they're not ready. They're not capable of breaking it down. Okay. Um, we want to make sure after we start them on the iron fortified rice cereal, then we start them with the fruits and veggies and then the meats. Okay. Feeding them sooner than the 4 to 6 months can expose them to food antigens and it can produce food protein allergies. So you just want to make sure that you watch that. Okay. We can start to give egg yolks within that 7 to 10 months. Okay. And then that 12 months, we can give the Cheerios to help promote that pincer grasp. I will say, I know I said that that's a picture of my child. I promise you that is not a picture of me. Wouldn't do that to y'all. Okay, back to Erickson. Now we're going to move up to the toddler, which is the 1 to 3 years. Autonomy versus shame and doubt. This is a picture of my son. This is my youngest son that I couldn't find one day. And I looked all around the house for him, and he climbed up my stairs, climbed up onto the step stool there, and was sitting in the sink wanting to brush his own teeth. Prime example of autonomy. And I didn't yell at him. I safely got him down and put the gate up, but that's what happens when you're not all eyes on them and when you're the youngest. So this, with this age or this phase, you want to allow the child some independence, right? Allow them some independence. Children who are constantly told, don't do that, nope, you'll hurt yourself, no, 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 don't, all the time will not develop a sense of autonomy. They need safe opportunities to help for them to exert their independence. So let them, try putting on their socks. Try to give yourself enough time to help them, independently put their socks on, maybe put their shoes on, and then you fix it, obviously, for safety reasons, right? They're going to gain about 5 pounds per year. Like we said, 2-word sentences by age 2. So by the age 2, they should be saying 2-word sentences. They're going to have a decreased appetite. We refer to this as a physiologic anorexia in toddlerhood. So the growth rate slows and the child appears like they're not eating very much. They tend to graze on food. Okay, so putting out just healthy snacks for them to kind of graze on can help address to promote that growth. Ritualisms. Toddlers spend a lot of time learning new things, right? So to balance this, they need to have rituals to help them feel secure. So they may insist on using the same spoon for, feeding themselves at meals, or the same red sweater to go outdoors. Okay. This is okay. And it really kind of helps to compensate for all the new things that they're doing and learning. Temper tantrums, right? We I think all know about temper tantrums. We want to ignore it if safety is not an issue. These kids may even hold their breath. But if this behavior is ignored, it will stop and they won't be harmed. Okay. They're normal at that age because the toddler knows what they want. The toddler knows what he or she wants, but they don't have the words to express what they what those wants. They don't have the words to kind of express it. So what that all causes is frustration. Okay, so these tantrums is not just a, troublesome child. It's just their way of not being able to fully express what they want. Toilet training. So like we said before, we don't want to put too much pressure on them to, attain this toilet training, but we are going to introduce it at this age. They need to be able to walk, right? They need to be able to feel when they need to defecate. Usually, most children are trained by 3 years of age. So, this is 1 to 3 years. Usually, by the later end of this phase, is when we have accomplished our toilet training. Negativism. This is the search for autonomy is limited by their language skills, which elicits a tendency to say no all the time. No, no, no. When they say no all the time, it's just because they have that limited language skills, which elicits that constant no. All right, the toddler years. Look at that. My two loved each other once upon a time. The toddler years include sibling rivalry. Okay, so we want to expect regressive behavior when there's an arrival of a new baby. Okay, so you want to educate those that are multips, those that are introducing new siblings to the family, that there may be some regressive behavior with that older child. Okay, despite all the preparation you can have and all the all those parties now, that the gender reveals and all those parties that we can include these older siblings, they can wear all those cute shirts and be a part of it. The arrival of a new baby is really kind of a crisis for a toddler. So you want to advise realistic preparations, right? Having a new playmate, saying you're going to have a new playmate, that's totally unrealistic for a toddler to understand that I have a playmate who is a new baby, right? So you need to just address some of the regressive behaviors. Things like illnesses, hospitalizations, new sibling separation. These are all triggers for regressive behavior. So we just really want to ignore that regressive behavior. Ignore it when we can and praise achievement of those current tasks. That'll help get them through that phase. Okay. Parallel play. This is where they won't share, but they will play side by side. I have a picture here. These are not of my kids, but it's a good picture of showing that parallel play. They play alongside each other, not with other toddlers. Okay, so teach the parents not to expect sharing. It's better to provide the same toy for each child that's engaged in the parallel play than it would be to expect them to take one toy and share it. Okay, these toddlers, they like their push-pull toys and their fill-empty toys. All right, so here is an example of that parallel play also, and I will say that this is my children. That's actually my nephew with the sunglasses on, and then that's my son. So we have two bins, two children playing side by side. Transitional objects. What are transitional objects? These are also very important for the toddlers. These transitional objects provide a sense of security for these toddlers. It's a sense of security to return to after a whole day of trying new things during their day. Okay, so it's unrealistic to separate a toddler from that transitional object at this age. So think of that in terms of nursing implications, right? It's unrealistic to take that item away when that means more to them than anything. Like this blanket here, this Lightning McQueen blanket went everywhere with us. So just keep in mind that's a transitional object. I think we already really talked about temper tantrums, right? This is their independence and trying more complex tasks, which causes frustration, which causes the tantrums, right? So we want to ignore it, keep them safe from injury, try a timeout if they're 18 months or older. Try to identify any triggers that'll cause these temper tantrums and avoid them if possible, okay? All right, nursing management. with the toddler. So promoting safety, right? Accidental ingestions of poisoning or small objects is kind of seen with this population. Now that they're that autonomy versus shame and the doubt, they're using that exploration to go around. That's when they start to get into things. So we want to make sure that we have the there's locked cabinets, right? That they can't climb on things because of that accidental ingestions or poisonings. um, Motor vehicle accidents. The children are at risk, so we need to make sure that they're properly restrained in a proper seat, whether it's a car seat, and making sure that they're using those restraints properly. We want to watch the stoves for burns, um, drowning, right? So locked fence for pools, and transfer them to a bed, a big boy bed, if they're starting to climb out of a crib. Okay, if they're starting to climb out of the crib, that's a huge safety concern. That is now time to graduate to that big boy bed. Okay, we're going to talk about nutrition a little bit more on the next slide. We want to promote development by promoting autonomy through their ADLs. So let them try to dress themselves first, um, even if it's not perfect, right? Promoting sleep. So making sure that they get at least 12 hours a day. And this is where we start to decrease down to one nap a day. It's kind of a sad time because you lose those two naps from infancy. So they need at least 12 hours of sleep a day with the incorporation of one nap. And you want to allow for bedtime rituals, okay? Consistency with their bedtime. Promote or permit that transitional object, right? Like that blankie that they want to go to sleep with. That's okay. Promote healthy teeth by allowing them to use a toothbrush with the help of the parents. So maybe let them brush first and then it finishes up with mom or dad. Promote promote healthy family functioning. Again, advise the parents to allow for graded independence and the understanding of the importance of why we do so. And then healthy toilet training, right? The child, like I said, should be walking, needs to be able to pull their pants up and down, as well as recognize their need to eliminate. I will say that is not my kid. Okay, nutrition years, or nutrition during the toddler years. We talked a little bit about physiologic anorexia, which occurs at around 12 to 18 months as the growth rate slows. So there's decreased calories and proteins and fluids that are needed. They may also have food jags, which is where they eat a certain food for days on end, such as macaroni and cheese. Same thing every day, every day, every day, and then all of a sudden, nope, we're done with that. Um, Generally, 1 tablespoon for every year of life is going to be the serving amounts, 1 tablespoon of whatever portion it is, um, for every year of life. If they are on a food jag, like I said, they may eat only one thing at a time. So you want to tell the parents not to worry. If it's generally over 3 to 4 days, they'll eventually consume a well-balanced diet despite of the food jags. Okay. Provide for self-feeding. Finger foods help promote autonomy, um, and they can choose if they want to use their spoon or their fingers. Okay. Moving on to the preschooler, 3 to 5 years. Body contour changes. They become what we call ectomorphic, which is slim, or endomorphic, which is large. These body contour changes become apparent. So you'll either see like the ectomorphic or an endomorphic contour of the body during this phase. Their social and language skills are going to increase. They have a vocabulary now of about 900 words. They ask tons of questions constantly, up to 400 times a day. The how and the why. Their appetite remains the same as it is during the toddlerhood. It may slow down. They may have those food jags, so they eat, peanut butter and jelly all the time, or bologna, or hot dogs, or nuggets, for example. They do have this fear of the dark, mutilation, and abandonment. These are three true, real fears for them. Okay. Um, so you got to keep in mind if they do have a fear of the dark, you may need to provide a night light. Okay, if they're having a fear of the dark in the hospital room, you may need to leave the bathroom light on. They have a fear of that mutilation, so you're going to need to provide band-aids for even the tiniest little, capillary draws or venipunctures, anything that is going to break the skin. To them, it's like they're being mutilated. So make sure that you've got the cute little band-aids to cover up on that. Okay. Um, and then the fear of abandonment as well is going to be like real to them. All right, associative play within the preschool years. Um, the associative play comes with a really strong imagination and dramatic themes. This age group has a profound imagination. Their imagination can take them so many places because it's just during this intense time of always thinking and with their beliefs, it creates these dramatic themes. This is when they like to assume adult roles in play. So this is where they really like to dress up as, firemen, policemen, doctors, nurses, teachers, things to mimic the adults. So you want to provide toys that also mimic these adult roles, such as like dress up clothes pictured. Now, the magical thinking we already talked about before. This is where their thoughts are quote unquote all powerful. So if they're mad at mommy one day and then mommy gets sick that day, they're going to think I caused it, right? The Oedipus and the Electra complexes in preschool is also prevalent. The Oedipus is where they have a strong emotional attachment a preschooler boy demonstrates towards his mother. And the opposite, the Electra complex, is the attachment of a preschool girl to her father. So there's that attachment that you see. Boys become attached to their moms, and girls become attached to their dad, and that's that Oedipus and Electra complex. All right, preschool behavioral variations. Oh, telling tall tales. This is where they stretch stories out to make them seem more interesting. They can stretch out walking to the mailbox into this big, long tale. Okay. You want to caution parents not to encourage this kind of storytelling, but instead help the child separate the fact from fiction. Okay, it's not necessarily detrimental unless it's encouraged, and they'll get that gratification from the parents encouraging them by making them happy and making them proud, and then can kind of spiral into an unhealthy, kind of like lying behavior when they get older. So helping them identify and separate fact versus fiction is kind of the way to go. Imaginary friends, right? Um, ask, ask the parents if the child has exposure to real playmates. We don't want to discourage the imagination as long as it's not preventing any kind of socialization with other children. Difficulty sharing. Children who are ill or under stress have an even greater difficulty with this than usual. We want to assure the parents that sharing is a difficult concept to grasp, and that, as with most skills, it needs practice to understand and learn it. Okay, so define the limits and expose children to the three categories: mine, yours, and ours. This is going to help them to determine what belongs to which category: mine, yours, and ours. regression. This is definitely seen within in a relation to stress. All right, as seen with thumb sucking, negativism, loss of bladder control, and an inability to separate from their parents. So that's separation anxiety. Um, Remind parents that the children's reaction to stress, like thumb sucking, is little different from your reaction to stress, nail biting, smoking, overeating, right? Similar. It's a way to cope with that stress. And then the sibling rivalry, we kind of already talked about this, right? To help those preschoolers feel secure and promote self esteem, we're going to supply them with something to help maybe incorporate that child, that smaller child, into their home. Kind of helps promote that self esteem and they don't feel like they get left behind. All right, nursing management in the preschooler. So we want to discuss age appropriate recommendations, okay? Wellness visits, screenings, immunizations, dental care. We want to teach about proper hygiene. These are all things when we say age appropriate recommendations, we need to know when should they be getting their well care visits. After the first year of life, it's usually yearly. Within that first year, there's frequent visitations to the pediatrician for the wellness checkups. Whereas after that, it's really just once a year for their annual, and then they're seen as needed for sicknesses and illnesses. But we also look at their immunization schedule. Okay, so you guys do want to know the immunization schedule, when they should be seeing a dentist, as well as when we can transition from baths to showers. We want to teach them nutrition. We really want to start to discourage that grazing that was once allowed and now encouraging new foods to kind of get an eclectic palate. Sleep patterns. We want to discuss the management of any nightmares that they may be having or that they may be encountering because of all of that imagination that is like brewing within them. And we want to still promote rituals. So same bedtime pretty much every day, right? That ritualism really comes into play. We want to help foster that imaginative play when it comes to growth and development, and have the child participate in family rituals and make sure that we're addressing their fears. The fears of the dark, the fears of going to sleep, right? The boogeyman, he becomes real at this age. We want to make sure that we give them that their fears are recognized and that we need practical methods to help deal with them, such as a nightlight, right? For the fear of the dark. And then safety, we're going to talk about that on the upcoming slide. So nutrition during the preschool years, small servings. You can't really put a whole entire plate of Thanksgiving dinner in front of them and expect them to eat. They're going to take small, frequent meals, small servings frequently throughout the day. Allow for participation in the food preparation. So allow them to maybe put together some of the meals. That's going to help encourage them to want to try it, right? Because they made it, they want to try it. So incorporate them into meal preparation. That's going to help, like I said, boost those the food groups that we want them to eat. If they are vegetarian, if they come from a family where they are a vegetarian, we want to make sure that they're getting enough calcium, vitamin B12, and D. Okay, and this is true for all the age groups who are on vegetarian diets. Making sure that we're getting enough of that calcium and vitamin D and B12. All right. School age years, 6 to 12 years. How their body changes. They become slimmer and stronger, and they have an increase in their fine motor skills. They have a growth spurt during that prepubescent period. Girls is around 10 years and boys is around 13 years. Their permanent teeth erupt. The first permanent teeth to erupt is their 6-year molars. And then their permanent teeth erupts in the same sequence as their primary teeth. So primarily, the bottoms and then the tops. FYI, dental cavities or caries, the risk is greatest between 4 and 8 years of age. So 4 and 8 years of age, and then 12 and 18 years of age. Latchkey kids, these are considered latchkey kids, kids that are that come home to an empty house because their parents are working. They have a key to get themselves in safely, and safety is our biggest concern with this. You know, a lot of schools now won't really allow for kids that are school age kids, especially because this is 6 to 12 years. So they may not allow a first grader to come home to an empty house. They want to make sure that somebody is there overlooking them. But once upon a time, kids did come home. I came home to an empty house, and first thing I had to do was call my mother and tell her I was in safely and lock the door and I wasn't allowed to cook anything. And because it is safety that we want to take a look at with these kids. But if you ever hear the expression latchkey kids, that's our school age population. Concrete thought. The concept of conservation now is that the matter does not change when the shape changes. So they've got that concrete thought. Cooperative play, rules, and routine. These guys like the rules and the roles. Okay, they like to know what are the rules, whose roles are what, and they like routine. Okay, a team effort is important with them. The obesity risk begins. So this can be either because of environmental factors, cultural influences. We want to make sure that they're getting in that physical activity every single day. The peer group starts to become a bigger influence with them. Not as much as when they get into adolescence, in which we'll talk about that, but now it's not, it's turning from the all important about me, that egocentrism, to looking at our peers. And then we also want to introduce sexuality and inappropriate touch. Avoid any exposure to any erroneous information. The schools often teach factual information if the parents can consent. So we want to make sure that within each visit, wellness visit, that we're teaching these kids at this age about inappropriate touch. Okay. All right. All right. So nursing management, discuss age appropriate recommendations. Once again, well care visits, screenings, immunizations. Um, Teach them nutrition. The more independence they have, the increase of chance for poor food choices, right? If they're going to have their option of what they want to eat, it's going to be McDonald's every single night. Okay, so just keep that in mind. We want them to have the independence, but the more independence comes with more poorer choices. So teach them healthy food options. Sleep patterns. Encourage a bedtime of about 8 to 9.5 hours of sleep at night. Okay, and these guys generally aren't taking naps during the day. If they are taking naps during the day, you got to take a look at what their schedule is and if they're getting the 8 to 9.5 hours of sleep at night. We're going to be discussing growth and developmental milestones with these parents and what milestones they should be achieving, as well as healthy family dynamics. And we want to promote skill development in school, sports, and play. So really encourage those gross motor skills. With boys, they have more of muscle cells. Girls have more of a fine motor skills, okay? So refinement in both the fine and gross motor skills occurs during this time. And safety, okay? Safety. So we want to take a look at safety, in which we're going to talk about that on the next slide. All right. But I also just want to talk a little bit about what this says here. Kids want to know, why do I wake up at night with leg cramps? And one of the things I want you guys to think about is why do kids this age, school age, wake up in the middle of the night with these leg cramps? And this is what the parents are going to be asking you. They're growing pains, right? Growing pains that are temporary and are caused by bones that are growing faster than the muscles. Okay, so you just want to give them dose appropriate Tylenol and or Motrin to help get them through these types of growing pains. All right, so some nursing interventions or considerations within the healthcare setting when it comes to, safety and in the healthcare setting. So with the infancy, like we said, we want consistent contact and feeding, right? Meet those needs. Crib rails up at all times when they're in the crib. Toddlers, we want to allow for those transitional objects. Prepare for that. No. Okay, remember they can't conserve when giving those liquid meds, and full crib rails at all times. Okay, the preschooler, dramatic play. Use dramatic play to your advantage to help explain the care. Okay, so you listen to Daddy's heart first, and then I'll listen to your heart. Okay, allowing them to kind of do it first. Do you want to listen to my heart first, or can I listen to your heart first? Okay, apply those concepts of animism. So, take a listen to Teddy's heart, and then I'm going to listen to your heart, right? That can be used at your advantage. School age, you can give them more detailed explanations, provide them with the same age roommate in the healthcare setting. Um, Involve parents to room in for all age groups, okay? And select age appropriate play activities. So, this is why the RN needs to be knowledgeable of appropriate play activities to help promote and foster that healthy growth and development and safety for various ages for children in the healthcare setting, as well as teaching parents. So, safety in childhood. Once again, we want to prevent aspiration, especially within the first year of life. We want to prevent falls starting from birth on up, prevent poisonings, especially after walking and during the toddler years when they're on that exploration of autonomy, preventing burns, especially after they start walking and through school age. Remember, I said the latchkey kids. If the latchkey kids are coming home on their own, most likely they're going to be making themselves something to eat. We want to really prevent burns within this age population. Okay, so maybe microwave only, know when to operate it, know how to operate it. I would avoid anything with a lit fire. Preventing injury from firearms, especially your school age kids. So if they are in a household with these firearms, it needs to be locked up at all times. And preventing drowning, especially once they start walking. Okay, you need to make sure that there's a fence and a lock around the pools outside, as well as not leaving the toddler unattended with a bathtub full of water. Okay, and then we want to implement car safety from birth on.